Hi, my name is Mia. I'm going to be responding to discussion post 6, and this is my audience member. Are you or someone you know depressed? Did you know that about 50% of people who are depressed or diagnosed with depression are also diagnosed with being extremely anxious? We oftentimes think depression is a type of disorder that generates from stress, but that isn't always the case. It can be triggered by a number of things, everything ranging from chemical imbalances in the brain to lack of sleep or nutrition. Today, my topic will be about depression and how to identify it, what it is, who does it affect, and if there's any treatments for it. So, what is depression? Depression is a mental illness associated with anxiety. It causes an individual to feel hopeless. It also influences their motivation towards certain things. This meaning loss of motivation for appetite, loss of motivation with interactions, or just feeling lost and alone majority of the time. How can we identify depression? So we can identify depression through lack of sleep in an individual. So for instance, if you had a brother or sister who you thought were depressed, you would notice their lack of sleep patterns, maybe dark circles around the eyes, loss of interest in hobbies, or just hanging out with family in general. They're easily agitated or anxious around certain crowds or certain people, or just little things trigger them and set them off. And there's also visible weight loss in that person. So as I mentioned, if you have a brother or sister who you think are depressed, you would know that, or you would notice certain changes within that sibling. Who does it affect? So depression affects not only the person that is feeling depressed, but it also affects relationships with their family and others. This can result in, like I mentioned, feeling lonely. It can also result in losing connections with certain people that you wouldn't normally want to lose connections with. In the career aspect, it does affect your professional status in the workplace. So, this being if I were to go into work depressed and sad, moody, or whatever the case would be, I wouldn't be giving my 100%. And in the workplace, that is something that you have to give. This also means that for the employer or whoever you're employed by, it is hard to manage anyone who is depressed. So, depressed employees really don't show much performance. So, in that case, it would be low performance levels and also unproductivity. So, you're not as productive as you normally are. As I mentioned, depression is treatable but not curable, but there is two forms of treatment. These two forms of treatment do entail psychotherapy, which would be talking with a mental health professional. And this can help anyone who is depressed or you yourself by identifying the depressive traits and how to better manage them. Sometimes people who are depressed, they do need just somebody to talk to and release their thoughts, not to keep it all to themselves majority of the time. They also need someone who is willing to provide a no judgment zone, which a mental health professional can provide. The second form of treatable ways to cure it would be prescribed medications. So this would entail like medicines such as antidepressants. There are different forms of antidepressants. You just have to find a suitable one for you. So in order to do this, you would have to speak with a medical professional and see which one works best for you, since they all do have their own, I guess, side effects to them. So if there was one that had really bad side effects, you wouldn't want to go with that one. You would want to go with a different one that better suits you and accommodates you. Also, in conclusion, it does have various forms of treatments. As I mentioned, psychotherapy and medications can help, but if it is, or if it does, or if the depression does extend beyond just psychotherapy and medications, there is always hotlines to call. There's always other people to speak with as well. It's never just you by yourself alone in your head. It can affect an individual's life in every aspect, not just in their own daily routines, but it affects who's around them, who lives with them, who they interact with on a daily basis, and it also affects their workplace. Keep in mind it can be shown through explosive episodes. So this would mean, as mentioned, being easily agitated or tired constantly. It also includes weight loss, and it does, or it is mainly seen through lack of interest. So as mentioned, once again, if you had a brother or sister or just any sibling who was very active and just suddenly stopped becoming active and started losing weight, not really caring too much about things that they used to care about, you would have figured that they might have been depressed or experiencing depression by themselves. So if that were the case, maybe just speaking to the individual, see what's going on. Maybe they just need someone to talk to.